Stop everything.
Right now.
Whatever you were doing, put it down. I need you to hold up your hands and look at your fingernails. Not the polish, not whether they need trimming. I mean, really look at them. The surface, the texture, the ridges, the color near the base, the tiny crescent of white, or the place where it used to be. Most people haven't truly looked at their nails since childhood. They've trimmed them, filed them,
Painted them.
bitten them down to nothing during a stressful phone call. But they have never once read them. And that is a serious problem. Because the nails on your hands right now, the ones you're looking at this very second, may be displaying warning signals that your body has been desperately trying to send you for months. Possibly for years. Your nervous system has been talking. Your kidneys have been talking. Your brain has been talking. And your fingernails have been writing it all down. You just didn't know the language. I'm Dr. Franklin. I've spent my career in neurology, specifically in the field of how serious systemic diseases express themselves through the body's peripheral systems long before any dramatic symptom appears. The skin, the extremities, the nails. And I'm going to tell you something today that most doctors will never say in a standard 15-minute appointment. Your nails are not cosmetic. They are a biological record. A living document of what has been silently happening inside your body, written in a language almost nobody is ever taught to read. After the age of 60, your body's biological buffer, the margin between quietly struggling and full crisis, becomes dangerously narrow. The reserves you had in your 40s are gone. And in that narrowing window, the fingernails become one of the last places where your body still leaves a visible trail. Today I'm going to show you 4 specific nail signs, each one linked in published medical research to 4 serious conditions that disproportionately affect adults over 60. 4 signs. 4 diseases. The first involves your brain's motor system. The second involves your kidneys, silently failing for years. The third involves a deficiency that gets misdiagnosed as early dementia. And the fourth I've saved deliberately for last is the one that I see most often in patients who spent years being told their symptoms were just aging. Fatigue, memory fog, tingling in the hands, balance problems. All dismissed. All connected to something tiny and visible, right there on their fingernails, that nobody thought to look at.
Stay until the end.
What you learn in the next 25 minutes could change what happens to you in the next decade. Let's begin. Here is what almost no one is ever taught about fingernails. Your nails grow from a structure called the nail matrix, a band of living, actively dividing cells tucked just beneath the base of each nail, hidden under the cuticle. Those cells are not isolated from the rest of your body. They are in constant, real-time communication with your bloodstream, your peripheral nervous system, and your metabolic environment. Every nutrient your body absorbs or fails to absorb passes through the tissue feeding your nail matrix. Every toxin your kidneys struggle to clear. Every inflammatory signal traveling through your system. All of it leaves a mark. Think of your nails like a geological record. When scientists cut into ancient rock, they can read history in the layers, what the climate was like, what volcanic eruptions occurred, what changed over thousands of years. Your nails do something remarkably similar. They grow slowly, about 3 millimeters per month, and as they grow, they encode a record of what was happening inside your body during that time. A major nutritional disruption 3 months ago may show up today as a ridge crossing your nail. A chronic metabolic problem may express itself as a persistent change in nail shape or color that has been quietly building for years. After 60, the peripheral nervous system, the network of nerves running from your spinal cord into your hands and feet, becomes increasingly vulnerable to nutritional deficiency, reduced circulation, and systemic inflammation. And because the nail matrix is fed by peripheral vessels and nerve-adjacent tissue, it often reflects distress in those systems before any other visible symptom appears anywhere on your body. Your doctor is not failing you by missing this. Nail examination as a diagnostic screening tool is simply not standard in routine primary care, unless something is already visually alarming. The result is that early warning signs go unnoticed, sometimes for years. So, let me show you exactly what to look for. Sign 1. Asymmetric vertical ridging and early Parkinson's disease, 5:30 to 11:30. The first sign is something many adults over 60 are already seeing on their nails and have been told is completely normal. Vertical ridges, lines running lengthwise from the base of the nail up toward the tip. Sometimes fine, sometimes pronounced enough that you can feel them when you run a fingernail across the surface. Now here is an important distinction. Mild, symmetrical vertical ridging across most of your nails after 60 is often benign. The nail matrix, like every other tissue in your body, becomes less efficient at producing a perfectly smooth nail surface as the decades pass. That part is true. But there is a specific pattern of vertical ridging that is entirely different. And the difference is critical. What I am describing is ridging that is noticeably deeper on one hand than the other, accompanied by nail brittleness that has been getting progressively worse over 12 to 24 months, appearing alongside even subtle changes in finger tremor, in the size of your handwriting, or in your grip strength on one side. This asymmetric pattern, particularly when paired with other peripheral nerve signals, has appeared in clinical literature in association with early Parkinson's disease. Here is the neuroscience that most people are never told. Parkinson's disease is not, at its beginning, primarily a movement disorder. That is a widespread misconception. In its earliest stages, Parkinson's is a disorder of the peripheral and autonomic nervous system. The dopamine-producing cells in the substantia nigra, the cells most associated with Parkinson's in the public understanding, are not the first cells affected. Research into the prodromal phase of Parkinson's, the period that can precede a formal diagnosis by up to a decade, has consistently found that peripheral autonomic dysfunction, including changes in skin and nail health connected to nerve supply, can appear years before any tremor becomes clinically obvious. The autonomic nerves that regulate blood flow and sweat gland activity in the fingertips also influence the tissue environment of the nail matrix. When those nerve signals begin to falter, as happens in early autonomic dysfunction, nail quality changes in ways that a careful observer will notice. I want to be precise. Vertical ridging alone does not indicate Parkinson's disease. What matters is the constellation of signs together. Asymmetric ridge progression, combined with handwriting that has become noticeably smaller, combined with any new tendency to shuffle slightly when walking, or a reduced swing in one arm, combined with any recent change in your sense of smell. That last point is critical. Loss of smell is one of the most reliable early markers of Parkinson's in the prodromal phase. Almost no one connects it to the disease until years later. I have a patient I'll call Raymond. He was 67 years old when his wife first brought him to my attention, concerned that his handwriting had become dramatically smaller over the previous 18 months. When I examined his hands, the ridging on his left thumbnail was unmistakably more pronounced than on his right. He had assumed it was simply because he was right-handed. He also mentioned, almost as an afterthought, that food hadn't tasted or smelled quite right for the past year or two. The combination of those observations, not any single one in isolation, led me to refer him for detailed neurological evaluation. His early-stage Parkinson's diagnosis was confirmed. Because we identified it in the prodromal phase, his treatment began at a point where it could meaningfully protect his quality of life for significantly longer than if we had waited for an obvious clinical presentation. What to do right now? Hold both hands side by side under natural daylight. Look specifically at your thumbnails. If the ridging pattern looks noticeably different between your left and right thumbnail, write that observation down. Note whether your handwriting has changed in size. Note whether your sense of smell feels different than it did 2 years ago. At your next appointment, ask your doctor specifically for a neurological screen. Sign 2. Horizontal grooves and chronic kidney disease, 11:30 to 17:30. The second sign is one that people often notice, because it appears suddenly enough to catch the eye, but almost never understand. Look across the width of your nails. Not along the length, but across it. Are there any horizontal grooves or indentations running from one side of the nail to the other, like a line pressed into soft clay? These are called Beau's lines, named after the French physician who first documented them in the 1840s. Here is how they form. When something disrupts the nail matrix severely enough, a serious illness, a high fever, major surgery, a significant metabolic shock, the matrix temporarily stops producing nail tissue. When it recovers and resumes growing, the nail moves forward but leaves a groove behind at the point of interruption, like a gap in a geological layer. A single Beau's line appearing across multiple nails simultaneously often follows a major, systemic event. If you had a serious infection in the past year or two and now notice a groove crossing several nails, that is very likely the explanation. This became so well documented following the COVID-19 pandemic that clinicians gave it an informal name, COVID nails. But here is where it becomes serious. Recurring Bose lines, multiple grooves at different heights on the same nail, or grooves that keep reappearing without any clear illness to explain each one, tell a profoundly different story. In adults over 60, recurring Bose lines without an obvious episodic cause have been associated in clinical literature with chronic kidney disease. The reason lies in kidney biology. Your kidneys filter metabolic waste from your bloodstream, including nitrogen-containing compounds that, when they accumulate, become directly toxic to cells. When kidney function begins to decline, a condition called uremia develops, a buildup of urea and other waste products in the blood. These compounds are harmful to rapidly dividing cells, and the nail matrix divides faster than almost any other tissue in your body. Even at subclinical levels, before any dramatic symptom appears, uremic stress on the nail matrix is sufficient to interrupt normal nail growth. Repeatedly, chronic kidney disease affects a significant percentage of adults over 60. In its early stages, it is almost entirely silent. Most people discover it only when a blood test reveals it. But some of those people have been watching grooves reappear on their nails for years and dismissing them as nothing. There is a second nail sign worth noting here because it frequently appears alongside Bose lines in the same patient. It is called Lindsay's nails, or half-and-half nails. The lower portion of the nail appears white or pale. The upper portion, closer to the tip, appears pink or brownish. The dividing line between the two zones is usually sharply defined. This pattern carries a strong documented association with chronic kidney failure. If you see both Bose lines and a half-and-half color pattern on your nails, that combination warrants a specific and direct conversation with your doctor about kidney function. I have a patient I'll call Margaret. She was 71, and for approximately 3 years she had been noticing a groove crossing her nails every few months. Each time, she assumed she had been mildly unwell with something she'd pushed through. She wasn't entirely wrong that something had been stressing her system. What she didn't know was that her kidneys had been slowly declining since her late 60s. When she came to me for an unrelated complaint, persistent leg cramping and a subtle morning fogginess, the combination of her nail findings and her symptoms prompted a full metabolic panel. Her kidney filtration rate was significantly below normal for her age. Early-stage chronic kidney disease was confirmed. Dietary adjustments and careful medication management have since stabilized her kidney function at a level where her long-term prognosis is considerably better than it would have been had we found this 2 or 3 years later. What to do right now? Look across the width of your nails. If you see one or more horizontal grooves and cannot clearly attribute each one to a specific significant illness, ask your doctor for kidney function blood tests, a basic metabolic panel including creatinine and eGFR. If you also notice a sharp color contrast between the lower and upper halves of any nail, mention that specifically and ask about renal function assessment. Sign 3. Spoon nails and the deficiency misdiagnosed as dementia, 1730 to 2230. The third sign connects most directly to neurological health, and it surprises people in a way the first 2 signs often don't. Look at your nails from the side. Most nails curve gently downward over the fingertip, a soft arc following the natural contour of the finger. But some nails, over time, begin to curve in the opposite direction. The edges lift upward. The center becomes concave, like a tiny spoon. If you placed a single drop of water on the nail surface, it would pool in the center rather than rolling off. This is called koilonychia, spoon nails. In adults over 60, koilonychia is one of the most important nail signs to recognize. Not simply because of what it says about the body, but because of what it means specifically for the brain. Koilonychia is most classically associated with iron deficiency. But here is the connection almost no one is ever told. Iron deficiency in adults over 60 does not just cause tiredness. It causes neurological symptoms, cognitive symptoms, memory-related symptoms, symptoms that in an older adult are routinely attributed to normal aging, or even to early dementia, when the actual cause is a correctable nutritional deficiency. Iron is not simply a building block for red blood cells. It is essential for the synthesis of myelin, the protective sheath that coats your nerve fibers and allows electrical signals to travel at full speed. It is essential for the production of dopamine and serotonin. It is directly involved in the metabolic function of the frontal lobe, the part of your brain responsible for executive function, memory retrieval, and processing speed. When iron stores fall, and they can fall silently in older adults through reduced dietary intake, medication effects on absorption, or subclinical blood loss from the digestive tract, the brain is among the first organs to suffer. And the nails, produced by cells that are highly sensitive to iron availability, can show structural changes well before the neurological effects become obvious to anyone. The neurological picture of iron deficiency in an older adult often looks like this: fatigue that seems disproportionate to your activity level, difficulty concentrating on things that used to come easily, a persistent sense of mental slowing, and frequently, restless legs at night, an uncomfortable, crawling urge to move the legs when lying still, one of the most overlooked neurological symptoms of iron deficiency, and one of the most distressing. Here is the point that matters most. Treating iron deficiency anemia in an older adult experiencing cognitive symptoms can, in many documented cases, produce a meaningful and measurable improvement in brain function. These are not irreversible changes in most cases. They are reversible consequences of a correctable deficiency. But they will not be corrected if nobody looks for them. And nobody will look for them if the nail sign that might have prompted the search goes unnoticed. What to do right now? Look at your nails from the side. If any nail has begun to curve upward at the edges, if the center has become slightly hollowed, and if you have experienced unusual fatigue, difficulty concentrating, mental slowing, or restless legs at night, tell your doctor you want a complete blood count, including iron studies. Before any other explanation for cognitive change is accepted, this must be ruled out. Sign 4. The disappearing lunula and what your nervous system is silently losing. 2230. 28:30. This is the one I promised you from the beginning. Look at the base of your thumb right now, just above the cuticle, where the nail begins. Do you see a pale, whitish crescent-shaped arc? A small half-moon sitting at the very base of the nail? That is your lunula. It is the only visible portion of your nail matrix, the living zone where new nail is being produced right now, as you watch. In a healthy adult, the lunula should be clearly visible on both thumbs. Typically visible on the index fingers, often visible on the middle fingers, less reliably on the ring fingers, almost never on the pinkies, and that is entirely normal. Now look more carefully. Is your lunula still clearly visible on both thumbs? Or has it shrunk back beneath the cuticle and essentially disappeared? Has it become a faint smudge of white rather than a distinct crescent? The gradual disappearance of the lunula, a process called absent lunula or nail matrix atrophy, has been documented in medical literature in association with several serious systemic conditions. But the one that concerns me most as a neurologist, and the one that is almost never discussed outside specialist practice, is vitamin B12 deficiency and its downstream consequence called subacute combined degeneration of the spinal cord. I recognize that phrase may be unfamiliar. Let me explain it simply. Vitamin B12 is arguably the single most critical nutrient for the long-term health of your nervous system. It is essential for the production of myelin, the protective coating around your nerve fibers and your spinal cord. Without adequate B12, that myelin begins to silently break down. This process, subacute combined degeneration, produces a recognizable pattern of symptoms: numbness and tingling in the hands and feet, difficulty with balance and coordination, unexplained muscle weakness, cognitive changes including disrupted memory, and in advanced, untreated cases, serious and sometimes irreversible damage to the spinal cord itself. What makes B12 deficiency uniquely dangerous in adults over 60 is that it typically develops slowly, silently, and for metabolic reasons, not simply dietary ones. After 60, the stomach lining produces progressively less intrinsic factor, a protein that is essential for absorbing B12 from food. Many medications commonly taken by older adults, including metformin for diabetes and proton pump inhibitors for acid reflux, further impair B12 absorption. The result is that a significant portion of the over 60 population is B12 deficient right now without knowing it. Because routine blood panels do not automatically include B12 in many clinical settings, it must be specifically requested. And the nail matrix, one of the most metabolically active tissues in the entire human body, reflects the consequences of B12 deficiency, sometimes years before neurological symptoms become obvious. The lunula shrinks. The matrix, deprived of essential nutrients, retreats beneath the cuticle, and the half moon that was once clearly visible quietly disappears. I have a patient I'll call Evelyn. She was 73, a retired school teacher, when her family brought her to me because they had noticed what they described as her slipping memory. She was forgetting recent conversations. She was occasionally unsteady on her feet. Her hands tingled at night. Her neurological examination revealed reduced vibration sense in her lower limbs, a classic early finding in subacute combined degeneration. When I looked at her hands, both lineally had completely vanished. She had no memory of when she had last seen them. Her B12 level came back critically low. She had been taking a proton pump inhibitor for nearly a decade. Her dietary intake of B12 was minimal, with high-dose B12 supplementation, delivered initially as injections because her absorption was so severely compromised. Her symptoms improved meaningfully over the following months. Her balance returned largely to normal. Her memory fog lifted substantially. And her lunulae, while they never fully recovered to their earlier size, began to reappear at the base of both thumbs within 3 months. That outcome was possible because we found it in time. And the first thread I pulled, the first sign that told me to look deeper, was the lunula. What to do right now? Look at the base of both thumbs. If your lunula is no longer clearly visible, and particularly if you have experienced any combination of tingling in the hands or feet, balance difficulties, unusual fatigue, or memory disruption, ask your doctor specifically for a serum B12 level. And if you currently take metformin or a proton pump inhibitor, tell your doctor today. The Complete Action Plan, 28:30, 30:00. We have covered 4 signs. Let me give you the clearest possible action plan. Today, right now, if you can, take your hands to a window with good natural daylight. Hold them side by side. Compare the texture, quality, and appearance of both hands. Note whether one hand looks noticeably different from the other. Look at your thumbnails. Check for asymmetric vertical ridging. Pair that observation with any changes you've noticed in your sense of smell, the size of your handwriting, or your sleep. Look across the width of your nails. Check for horizontal grooves. If you see them and cannot clearly explain them with a specific past illness, write it down. Look at your nails from the side. Check for any nail that has begun to curve upward at the edges. Pair that with any symptoms of unusual fatigue, mental slowing, or restless legs. Look at the base of both thumbs. Check for your lunulae. If they have faded or disappeared, and you've had any tingling, balance difficulties, or memory fog, that conversation with your doctor needs to happen soon. Photograph both hands this week. Good, even lighting, close enough to clearly see the nail base. Date the photograph. Save it somewhere you can find it again in 6 months. Within the next 30 days. If any of today's 4 signs matched what you found, especially if one sign is combined with any neurological symptoms, do not wait for your annual physical. Call your doctor's office. Ask specifically for a B12 level, a complete blood count with iron studies, and a basic metabolic panel including creatinine and eGFR. If you have any symptoms involving your hands, feet, balance, or cognition, ask explicitly for a neurological screen. And I want to close with this. None of these nail signs is a diagnosis. Every single one requires clinical context, your full medical history, your medications, your other symptoms, your doctor's examination. What these signs are is a prompt, a reason to have a conversation you might not otherwise have had, a thread worth pulling. The 4 conditions I described today, early Parkinson's disease, chronic kidney disease, iron deficiency with cognitive impact, and B12-related neurological dysfunction, share one defining characteristic. They are all dramatically more treatable when found early than when found late. And early detection is possible if someone knows what to look for. You now know what to look for. Your body has been your most loyal companion for 6 decades or more. It has been communicating with you through sensations, through symptoms, and through signs visible on the surface of your skin and nails that most people are never taught to read. The nails you glanced at this morning without a second thought may be the most honest diagnostic window your body has offered you this entire year. You just needed the vocabulary to understand what they were saying. Now you have it. End card. Subscribe plus comment CTA. Look at your thumbs right now. Can you see your lunulae? Drop yes or a no in the comments below. And tell me one symptom you have been quietly dismissing for the past year.